What's going on, folks? Your boy again, Dr. Sean Thomas here, back in the building. Be More Today's show. We are back in the building. And folks, we are here again, 100 plus episodes moving forward with Be More Today's show. It's been great being with you, showcasing therapists, MDs, PTs, so many people, yoga instructors who, again, are taking their steps to greatness to be the best version of themselves. And it's all about fitness and focus, about health and wellness. And this month, we've been focusing on my profession, I think the best profession, physical therapy, because it's Appreciation Month for PTs. And we had a therapist on the show last week, as you guys met, Mike Dunn. And today we have another great therapist on the show. But before I get into that, as always, I got to plug our Be More Today platforms. Again, the Be More Today show has been trending and growing for the last 2 years now. Heard in 63 countries, over 27,000 downloads. So it's been moving. It's been a labor of love. But again, the process has been amazing. We've met so many people who've done great things. And if you want to be a part of the movement, again, BeMoreToday.com for my book. Our show is on Amazon and on various places like YouTube and your favorite podcast platforms. And of course, our swag store with the more merch on there as well. So you want your visors, your bottles, those kind of things, go on there and subscribe to our show today. We appreciate you in advance. Our quote for today is simple as always. Missteps are opportunities for course correction by Adrian Townsend Benton. Missteps are opportunities for course correction. Now, a number of you have listened to the show and you're seeing how we highlight people who have had journeys to get to where they are in their life, whether it's professionally, whether it's athletically. And everyone shares a story about going through certain things and not doing things perfectly, but having some trials, having some failures, having some missteps that gave them a chance to get back on track, including myself. I share with many of you many times that I got into PT because I got hurt. I had an injury, and the injury sparked my interest in this physical therapy thing. And if I hadn't gone through that injury, there'd be no Be More Today show. There'd be no Sean at Jag-One. There'd be no us being able to meet other guests and seeing their progression, their stories, their journeys as well. So take these missteps as life changes. Don't take them for granted, because missteps, again, are opportunities for course correction. They can get you back to where you think you were going and where you need to be. And one of the things that I think that we lose track of is that we have to sometimes go through things and learn from our experiences and still learn, even as we go through life, that this life thing's about lifelong learning. And my guest on the show right now is the embodiment of that. She is a fellow PT just like me. She works at our office, Jag-One Physical Therapy, one of the best PT places in the Northeast, as you guys already know. And her name is Christy Raz. She is a DPT and an OCS. And Christy started working at Jag Physical Therapy in 2014. She then became a clinical director in 2016 at Cedar Knolls, New Jersey, and she has earned her OCS also in 2016. She shares that she likes treating pretty much everything and enjoys working with vestibular patients as well. Christy started as the Mentorship Co-Coordinator in 2019 and will be expanding on that role in the upcoming months. Outside of work, she's a huge Mets and Jets fan as well. And she has 2 young boys, and together they are a very active family. She loves to read, she loves to work out, and she loves to eat ice cream. Ladies and gentlemen, boys and girls, pets included, please welcome to the stage, Be More Today's show, Christy Raz. Christy, what is going on?
Thanks, Sean. And anybody that's watching, they'd see me throw my my Mets foam finger up here because, gotta have that.
We see you. We appreciate all of that. And thank you for making the time today to be on the Be More Today show. I appreciate it so much. And I know you're busy, so I want to just get right into it. You have been a pillar when it comes to so many things involved with Jag-One Physical Therapy. And I'm always curious when people like you who are so involved in leadership, involved in the mentoring, and the continuing education for our clinicians, what sparked you to even get into this profession of physical therapy?
Sure. So as you're reading that quote, I'm like, wow, that's me. So just like you, I had an injury. So my senior year of high school, I already had known I was going to Gettysburg College, and I like science, and I thought I was going to be bio major. And then I tore my ACL in the 7th game of the basketball season. So as soon, I had surgery, I started PT, and I really was like, PT is awesome. So it just was a natural fit for me. And even though I missed 2 sports senior year, I did play 4 years college softball. And so, I had the hardship, came out on the other side of it, and continued to, make the most of it. So that is how I got here.
Yeah, that's the journey. I mean, a lot of us have gotten hurt. It's so interesting listening to all the stories of people who got into PT after an injury, because I'm not sure if you did the same as me. I was a pre-med candidate back in the day, and that was my main focus, medical school. That was it. And then when I tore my meniscus, I said, oh, interesting. This PT thing is interesting. Let me check it out a little bit. But I wasn't really into it until I tore my meniscus again and had surgery again in college my senior year. And then that was kind of the nail that hit me on the head. Is okay, maybe let's look into this PT thing for real and see what's going on. But yeah, injuries have sparked a lot of us to get into this thing. And it's funny because patients always tell me, I'm sure they probably tell you as well, when you're doing certain thing with them and they're going through exercises and they're going through their journey, and they say to you, well, what do you know? You don't know what this feels like. But actually, we do know what it feels like. We've been there. We've been on the table. We've had someone stretch our knees and gone through the pain and the agony and the drama of what therapy is, to the extent that we like it so much to actually do this thing as a profession. So I'm always impressed when people have gone through the experience and then can be on the other end to share that with their patients. And you are basically that same person. So I appreciate that journey.
Yeah. It gives you compassion as the therapist that just makes a really deep connection. And truthfully, that's the biggest part of our job, is connecting with patients first to get them to trust us, so then we can help them heal. Yeah.
I like that you say connecting, because I think a lot of people lose sight of that being an integral part of being a good clinician. I mean, one of the things that you have to do once you learn all the board stuff and you pass your boards and you learn all the anatomy physiology, you have to be able to relate to people. And I think that one of the things that therapists can sometimes have an issue with is that connection. That trust, like you said, is something that is integral to make sure that the rehab process is a successful one. Because if there's no trust in the beginning, why should anyone do anything you're saying in terms of an exercise or a protocol or how many times to come per week? Any of those things, they go out the window if there's no trust. So you're right with all those things. And, I'm curious for you, because you are, again, a board certified orthopedic specialist, which is a very big thing now for us as clinicians to get that honor and that certificate and that training, that certification. What was the road like for you for studying for this thing, and how has it helped you now as a clinician?
So the studying is hard. I mean, it is for those that don't know, it is a big test, 4 hours, 200 questions, a pretty high percentage of pass, questions answered correctly gets you that pass. And it's all about current research and clinical practice guidelines, and what, it really strays away from a lot of old-fashioned thoughts, treatment that may be ingrained in like a lot of patients' minds, a lot of doctors' minds, and puts us at the forefront of our doctorate degree being an autonomous practice. So knowing the most current level of evidence for every orthopedic injury, right? So it puts a lot of pressure on you, and which is great. And honestly, as I was studying for it, and everybody has doubts that they're not going to pass because it's hard, I'm like, you know what? Just the studying alone has made me a better therapist. So luckily I did pass, but just the preparation for it made me look deeper into how I was treating and look at injuries and patients differently with a more current focus on the treatment and evidence.
Yeah, it's been on my bucket list for a while now. I'm not going to lie to you. And I know a lot of us have that same sentiment of, I have to get this thing done. But yeah, I mean, you're sharing real talk. It is rigorous, and it's going to be something that each of us should look into. But it has enhanced, it seems like, your treatment and your ability to really relate what's happening now with the current research that's happening now. The other thing I remember from school is research that's been old. And I love having students now, because they come to me with now the newest research, the newest protocols, the newest even exercises and trends that are happening in our profession that we sometimes lose sight of as we're treating people on a regular basis. And, the further you get from graduation date, which I'm sure we're probably in the same boat for that kind of stuff, it just gets harder to remember all the things that were happening, and things change. So I think, if you're saying the OCS is a great thing for us to all get into, and I encourage everyone else to go out there and to take that leap as well. It is on my bucket list of things to do. Just waiting for the right time to really give the amount of time I need to give to it to get done. Mm-hmm. But I'm proud of you for doing it, and others as well who've also done it. That's great.
Yeah.
That's great.
Yeah. I mean, you talked about, which is a good lead in why I'm part of the mentorship professional development team. I was really nervous for many years to take a student. I didn't think I was good enough therapist, or I just didn't know how to handle them. And then, I had a few, and they were teaching me things, or forcing me that, asking questions that, forced me to reevaluate how I was doing something, or just find the evidence for why I did it. And I was like, wow, me teaching them and they're teaching me, and I feel like we're both learning a lot from each other. So that's why I was like, here's a great opportunity. They're looking to me to make them better and prep them to come into the world of physical therapy. But they know stuff that is newer, has slipped my mind, that I can immediately put in the clinic too. So, I think it's great. And that's why I really am looking forward to my role in the professional development and education of the company to bridge that gap and really make a company of strong therapists.
Yeah. And I appreciate that. And I know that you, as a co-coordinator for the mentoring program, you can share a lot of things in terms of what you've seen, some of the struggles that young therapists have gone through, some of the loopholes that maybe we as clinicians have lost sight of when it comes to actually treating people and being able to treat them to the best of our ability. Can you share how important it is for new grads and even seasoned grads to take advantage of the opportunities that Jag-One is offering, and companies in general offering, when it comes to mentoring, continuing education, and other resources to help us to be better clinicians?
Right. So like anything, you kind of get in a routine and you like what you like. And whether you're a seasoned therapist, you tend to seek courses that you like. That'll make you better, but is it going to make you great? And is it going to expand your mind? And is it going to challenge you? So my co-director, John Elias, and I, every 2 months we're breaking down the body, going to different joints. So we're doing anatomy review, then we're going into treatment, then we're doing clinical pearls, things that come up on our end or that we've seen in the clinic, we like to share. So even if we're giving something, whether it's an exercise, a manipulation technique that therapist has not done or hasn't thought about or just slipped their mind, and it brings it back to the clinic, I think that's valuable. And I think as a company, we've grown and established ourselves and looking to bring more courses into Jag-One and hosting them ourselves, picking from different topics and going out on a limb on something that, maybe you haven't done, but it's going to bring back to the clinic and change the way we're treating in a positive way. That's really one of my big goals. Again, just making more well-rounded therapists.
Yeah, and I completely agree with all of those things. And I think that for me, one of the things that gets hard, as you become a little more polished as a clinician and your responsibilities, you start doing more things in terms of responsibilities in your clinic, you sometimes go into these routines where you're doing the same thing. And it's not on purpose. It's not like we're just doing this. Right. We have to. It just becomes our natural tendency to do those things because it becomes routine. And I like new clinicians because they come with new thoughts, new perspectives, new ideas. And there's no sense of tradition with that. Like, it's all about whatever they've learned and whatever they can apply to what's happening. And as polished clinicians as we have been, and with more work that comes on our plate, I do think that we can sometimes lose sight of the nuances, right? The new things that we can do, the new treatments that we can apply And that's why going to classes are great, because we get a chance
Mhm.
to see something new and fresh, and it just kind of reminds us of the different ways that we can see the same thing from different perspectives. And, for you and Jonathan Elias, who I got to give a shout out to because he's been doing some great stuff, you've been doing a great job with the mentoring program here at Jag-One. And I've had a number of my first year students and my first year clinicians and my last year
Mhm.
students who we hired go through the program and say that they really appreciated the conversation, the realness, the ability to really plug um, the clinical stuff along with the experimental and research things together. Because I think that transition is hard for some therapists to really be able to apply what they learned and what they studied in school to real life. And then seeing some things that you would think would work in the clinic, which don't work at all, and some
Mhm.
things that shouldn't work at all, which actually are very successful. So, I'm
Right.
curious, Christy, what inspired you at all? Because many people can just say, you know what, I'm going to be a clinician. I'm going to do my own thing, get my OCS, keep moving, but what inspired you to be a part of the leadership for the mentoring program? Because a lot of clinicians, I'm not going to lie to you, we get very caught up in just taking care of our own, taking care of our clinics and moving forward. But you're giving back to not just where you are in your clinic, but also to the mentoring and education
Yep.
of others around you. So what inspired you to even do that in the first
Yeah.
place?
So that's a tough question. I don't think I could say like one thing has inspired me, but I have been a team athlete sport like my whole life growing up through college. And I always kind of slipped into that role of a leader and making everybody trying to make everybody around me better. And that I think is just a natural aspect of my personality. Learning from people, trying to help them, trying to make it easier on them. Because in the end, if it's easier on my coworkers, my teammates, my family, then it's easier on me, right? So that's just a mentality that I have. Um, I so my clinic is on one of the smaller sides of the company, but we're really close. We get along very well, and we're constantly sharing stuff with each other and feeding off each other. And, I don't get offended if someone's like, hey, why don't you do X, Y, and Z with this patient? And I'll do the same to them. So I think that integration is really key. So if I'm doing that in my office and we have 100+ offices, why not spread it out and try and just make everybody better?
Yeah.
So that's it.
Yeah, yeah, I agree with the teamwork mentality. I also have been a part of many sports teams, just like you. So I do think that there is a definite teamwork atmosphere, whether in a small office like yours or a big one like mine in Georgetown. Um, it's a team. And, as a team leader, as you are, and as I am as well, I think our job is to really to rally the troops to make sure that we're all on the same page. Clinicians, PCCs, or our front office, and our aides, and even our interns and volunteers, just to make
Mhm.
sure that everyone knows what their role is. Because every team is only as strong as the weakest link, and every team needs to know what
Exactly.
goal is for the game for us to win. And I think officers that do really well have that same mentality that you're talking about. They go out there and they attack, and they really make sure the patient is first, and that everyone knows the knowledge that everyone can share with each other. I mean, I've learned so many things from my PTAs and even
Mhm.
from, like you said, your new students, just to help me to be a better clinician today. And I think you're right. It's really about us just recognizing that, we don't know everything. We know a lot, but we can always
Mhm.
learn from somebody. We can always do something differently. Treatment programs can vary from person to person. And as long as the patient gets better, then that's the goal. That's success. So
Right.
I appreciate you sharing that. And I know that you even share with you that you love treating everything, right? There's some people who love just working with knees or shoulders or just working orthopedics or what have you. But you're someone kind of like me who likes to see everything and treat everything.
I
And you
do.
mentioned vestibular as one of the passions for you. Is that something that you specialize in, and that's something that you just have a passion for?
I like it because it's a challenge. So it doesn't come as easy for me, and it makes me think, and it really forces me to reach out to some of my other coworkers and kind of work together when I have like not such a straightforward case. But I think PT is we're the clinicians spending the most time with these patients. Um, unfortunately, a lot of primary care, they just push it off to one. ENT then does a maneuver, push it off somewhere. So we're the ones spending time with these patients, and they deserve our attention and our expertise in it. So that's why That's why I do enjoy having those on my caseload here and there, just to give them what they may not get anywhere else. And we have the tools and capability to help them.
Yeah, yeah, I agree. What are some of the more challenging things you've heard, either new grads or even more seasoned grads share with you that they say, you know what, when I see this, I don't know how to handle it or I don't know what to do? Because like you said, a lot of people, PT becomes, I say, kind of the end of the road, right? They've gone to a number of places. We see them when they've had surgeries or when they've had chronic injuries, they've been in pain management, wherever they've been, and they come to us. And sometimes there's a savior mentality that comes with us being like, all right, help me. I have nowhere else to go.
Right.
Please help me.
Right.
And sometimes we can do those things. We can definitely help people get better, and we show them ways to live a better life. But sometimes there are situations where, we've done what we can, and someone might not get any better than how they already are. What are some of the more challenging things you've seen or heard from your clinicians as the mentoring program, leadership, et cetera, that you want to just share with the audience today?
So I think, first of all, the people that want to get better, we will find something to help them with. The toughest patients are the ones who are not putting forth that effort and aren't making the changes to, activity modification, doing their home exercise programs, consistent with their treatments. So that's part of it, right? Sometimes we could be the greatest therapist ever, but this patient's just never going to get better. Even though we're doing the right things, they might have just a mental block, right? But take that out of the picture. What I think challenges people, and again, one of my driving focuses mentoring new clinicians, students, is understanding how the body works and breaking down the biomechanics. Because I think a lot of times, we might see, depending if we're reading too much onto the script or post-surgical case and get narrow-minded and not breaking it down and looking a joint above or two joints above and seeing what is really maybe the root of the cause, or if we change something here, we might see it translate somewhere else. I think that is really what a lot of therapists but focusing on that the most will make a better clinician. So looking at the whole body, really evaluating how they're moving, what they're doing outside of the clinic, what they like. Sometimes it could be something as simple as they're sitting on their wallet the whole time, and that could be throwing something off. Or it could be some random, broke my arm when I was 5, never regained full, motion at my wrist or elbow. And now I have this weird back pain when I'm lifting overhead or something, and it's just, is that loss of motion here translating to a different, posture? So, I think that makes us like detectives and trying to find the real root of cause.
Yeah. Yeah. And I agree with that. And I think that's the beauty of a PT for me, being able to figure out and solve the problem, right? Solve the issue, solve the mystery. I love when people come to me and they say, look, my back hurts. Can you help me? I get a text message, really. They say, my back hurts. Can you help me? Give me some tips. I'm like, whoa. When did this start hurting? What's happening?
Yeah.
We've been doing that, done differently. Like there are questions we have to ask because people think that it's just a quick fix. And it's never going to be that way. There's so many things that really go into this thing. And that's why I love it. I really love this profession. I really love what we do. And I think what we do is impactful. I mean, beyond like the anatomy and physiology of just helping people, but really just seeing how we can really change lives. I mean, you being able to show someone how to walk again, how to be able to carry their baby again, in a hand after they had surgery, or just having someone be able to join and walk upstairs to go see their niece or nephew or their grandmother. Those kind of things are the stories that we hear when people are successful with their therapy. And they're so thankful when they actually trust us, like you said in the beginning, and do what we share with them to do. So my question for you now, what do you say to people who they're coming to therapy and they're not getting better, but they also are not doing what we ask them to do, right? They're not complying with their exercises. They're not really trusting the process, as I always say, but they want to continue to get better, but they're not putting in that work. As a team leader or a former team leader, as an athlete, what advice do you share with your patients when you are encountering people who are not getting better, but you recognize they're not getting better because they are not doing what they're supposed to be doing on their own to get better.
Yeah, I mean, those are the hardest conversations in the clinic because you have to get real with these patients and let them know that they have to make the change and say, you're not getting better because, your effort's not there. You're not taking the time out of your day. And I can only do so much. I can, our goal as a therapist too, for discharge or, get a patient either, 100% better doesn't always happen, but getting them 90%, giving them, a clear path, what they have to do and continue to do. And then I also take it back to me being a patient, and I say, look, my left knee has never, it gives me problems here and there. And it's a lifelong issue that I have to put a little extra attention to it. And if I feel it bothering me sometimes, I just do more reps or do more sets or whatever on that left side. So I understand that it's hard and it's difficult, and I wish I had that quick fix. But at the same time, this is what life dealt me. This is how you have to fix it. And if you don't take care of it, then there's really nothing else. There is no quick fix. There's no magic touch, magic treatment that I can do. It's on you.
Yeah, I appreciate you sharing that because I think about, it's my right knee actually is the one that I had surgery on. And yeah, I mean, I had surgery pretty much, I had it twice. I had it in 99 and I had it in 97. And sorry, 97 and 2002. And every now and then, still to this day, I mean, I do all these races and marathons, and doing Chicago actually very, very soon. And I find myself in this rut where I'm like, if I don't continue to do what I'm doing, then the pain will get worse. The symptoms will increase. All the things that I see my patients have will get worse. And that's what drives me, just to keep moving, because I already know, being able to see my patients and what they go through, having not had surgery, just having arthritis from whatever, right? I know that if I don't do these things now, that's where I'm going to be in the future. So, the things that I say, and I'm sure you as well, to your patients about doing their exercises, being compliant with what's going on, make sure that they are consistent with their exercises and doing things on their own. You live by that. I live by that. And I think a lot of that is real talk. And I think that also makes the connection with patients a little more real, because you're not just saying it, you're living it.
Right.
Because you've been through it. And I think when people recognize that, they have a better appreciation for, well, Christy says she's doing her exercises, so I'm going to also make sure that I do mine. And I love the stories when people come in and they say that they accomplished something over the weekend, or they were able to do something that they didn't think they could do. And now they can do that thing. And they're so happy. And I get happy when I see people do that, because it lets me know that we're making a difference. We're changing people's lives one day at a time. And for me, that's what this whole Be More Today thing has been about. Just making sure people can go out there and recognize their potential to be great. So, Christy, I'm gonna ask you and your dog. I'm gonna ask you and your dog. When you hear the phrase "Be More Today," what does that phrase mean to you?
So I think it means, be more present. Recognize every day what you're doing. It might just be a sentence you say to somebody. You never know how that's going to affect somebody, what they might remember from you. I think back my own life experiences are, what sticks out. Probably that person on the other side doesn't even remember, but to me, I remember it. So as a therapist, you never know, right? You can change somebody's life every day. As a person, as a mom, as a friend, as a wife, you just have to you have to appreciate everything every day and give it your best, because you never know when it's up, right? I mean, you really don't. And I get that. So there is no guarantees.
Yeah, no guarantees at all. No guarantees at all. Christy, what's next for you on the docket? Anything exciting coming up for you for the rest of this year or next year, either physically or work-wise, family-wise, dog-wise?
Work-wise, family-wise, dog-wise. I mean, you look at my calendar, there's something going on every day. But Nothing major that I know of, but that could only change, family things. I organize big block party in the fall for my neighbors. So we got some stuff going on.
Okay. Awesome.
Fun
Awesome.
time.
Awesome. Well, I appreciate you so much. And again, it's been a pleasure seeing you in person. I've seen you do so many things with our community and with our Jag-One in terms of mentoring and leading activities and workshops online. So thank you for your education. Thank you for your diligence to making our clinicians better. And thank you for making PT Appreciation Month one for the books. I appreciate you and all you've done for us so far.
Thanks, Sean. I love that you're a proponent in this company for all things health and fitness, and it's great. It's wonderful.
I appreciate you. Thank you so much. And folks, don't forget the quote from today by Adrienne Townsend Benson. Missteps are opportunities for course correction. You heard Chris talk about it, right? She said that she had also gone through surgery, and that led her to this awesome profession. And now she does so many things in terms of her patients, but also just to encourage and inspire and educate other clinicians to do the same thing, to go out there and to help the communities, to get people stronger, to get people to do what they wanted to do back in the day and what they want to do in the future as well, get back to their lives, to healthy lives, healthy living. And I'm just grateful that she continues to do that in her community in Jersey and all over the world. So Christy, keep doing your thing. And those of you out there as well, keep continuing to take your steps to greatness to be the best person you can be out there. Don't ever settle for things that go awry, right? We could have all just said, well, we're injured, we're done, no more. But we all bounce back from that. And if we can bounce back from our injuries, you too can bounce back from the things that have gotten in your way, the missteps you've taken, and get back on the course that you know you're supposed to be on. So don't give up, keep pushing forward, and we'll see you next week for another opportunity to meet another therapist for PT Appreciation Month. As always, follow us at BeMoreToday.com for my book, our swag store, the podcast, etc. If you want to send us any questions to me or to Christy, you can send it to me directly at Dr. Sean at BeMoreToday.com or any of our social media platforms. And as always, folks, check out Jag-One Physical Therapy, JagOnePT.com. We have over 100 offices in various states, New York, New Jersey, Pennsylvania, to go out there and just be a part of our movement, be a part of our family. We are community-based, and our job is to get you back to the life that you love. So continue to watch over us, follow us. We're following you. And as I always say, have a good day, have a good night, have a great life, and continue to take your steps to greatness to be the best version of you. We will see you next week. Peace.